Hi, happy Easter. I hope you had a wonderful day. Today we're going to be talking about the bony landmarks of the pelvis and hip, and also the movement and alignments of the pelvis. So there's 5 bony landmarks. It's the iliac crest, anterior superior iliac spines, the ASIS, pubic symphysis, ischial tuberosity, and greater trochanter. The iliac crest is the large upper wing-like portion of the hip bone. If you move your hands down from your waist, you can feel a large ridge of the bone. This is the upper border of the ilium. This convex border is called the iliac crest. For the anterior superior iliac spines, if you slide your hands down to the front of the iliac crest and then slightly down, you feel a bony prominence on each side of the front of the pelvis. For the pubic symphysis, it forms the lower and front portion of the hip bone. The pubis of each hip bone join at the front to form the pubic symphysis, connected by a disc of cartilage. The ischial tuberosity is a very strong bone in the lower and back portion of each hip bone. The lowest portion of each ischium has a roughened prominence. The forward portion on which we sit. The hip joint for the greater trochanter is formed between the hollowed socket of the pelvis and the rounded top of the femur. A large projection toward the top of the femur faces outward. This projection is called the greater trochanter. And for the movement and alignment of the pelvis moves primarily as a unit. The large movements of the pelvis mostly occur at the lumbosacral joint, which is the junction of the lower back with the pelvis. If you stand upright with your side to a mirror to observe the first set of movements of the pelvis, and you can see the related changes in the lumbar spine. For the alignment, when you are in a neutral pelvic alignment, for each ASIS, it's aligned vertically with the pubic symphysis. If you piece a poster board that were held vertically from the pubic symphysis, both the right and left ASIS would touch this poster board. In the neutral position of the pelvis, the lumbar spine is also generally in a neutral position, exhibiting its natural curve, not a diminished or exaggerated curve. For the anterior movement of the pelvis, if you rotate the top of the pelvis forward, each ASIS will be in front of the pubic symphysis. It's logically termed anterior pelvic tilt. This anterior movement of the pelvis will tend to increase the arch of the lumbar spine. For the posterior pelvic tilt, the curve of the lower back is decreased, flattened, or even reversed to round in the other direction, depending on the mobility of the spine. If you rotate the top of the pelvis backward, each ASIS will be behind the pubic symphysis. The pelvis can also tilt side to side. When the right ASIS is lower than the left, this is called a right lateral tilt of the pelvis. When the left ASIS is lower than the right ASIS, this is a left lateral tilt. This is observed more easily from a front view, such as facing a mirror. Lastly, the pelvis can also rotate. When the right ASIS is in front of the left ASIS, this is a left pelvic rotation. When the left ASIS is in front of the right ASIS, this is a right pelvic rotation. Thank you.